Anthony Weiner has called for a very robust public option, has made an aggressive and formidable argument for it. Anthony, your thoughts of the piece of legislation coming out of the House this morning?
Well, listen, if you consider that on your show and elsewhere over the last couple of months, we must have had 3 or 4 obituaries written for the public option. The fact that it has life is a good sign. But the question that I have is, who was it that was out there lobbying for less savings, less competition, and a less vigorous public option? I hope those people stand up today and say their names. But look, the fact of the matter is we are now moving down the path for a public option, which will mean competition. It'll mean choice, not as wide as you and I would like, but it's certainly much better than what we have now. And when you consider the odds that we came in against, again, taking on the health care lobby, taking on the status quo, the fact that every day we move closer to a public option for Americans make this a good day.
You asked the most important question, though. Again, I know that people say, oh, this is hard and this is too much and how can we do it and on and on. But the reality is, yeah, it is hard and it is a big problem and it is going to bankrupt our country. And unfortunately, we're young enough that we're going to be here for the next 50 years. So we might as well not drive ourselves into a wall. The people resisting most of this have either obviously been the insurance companies, Anthony, and then the unions have an investment in the public option for sure. They've been very aggressive about that, but it's been unclear as to how they feel about other forms of choice. Where have you found the most resistance to competition, choice, antitrust, public option, anything that would create a more liquid and fairer health care system in this country?
Well, I hate to say it, but anyone who's been arguing against the public option has been doing the bidding of the insurance industry. You know, they're the only ones that really benefit from the status quo. All the rest of us, the taxpayers, people paying for insurance policies, we're just giving more and more money to that industry. And the fact is they have a lot of sway in this town. But today's a day that you really have to put one up on the scoreboard for the American people, because the health insurance lobby is gnashing their teeth. Just a couple of weeks ago, they said, boy, if a bill without a public option, we're going to raise rates. Well, now there is going to be a bill with a public option. This is a loss for the healthcare industry, but we're not done yet. We still have to get the votes in the Senate. We still have to try to strengthen this as best we can before it reaches the president's desk.
There's another variable here, which may be the most important variable, which we don't talk about that much here because they don't really have lobbyists, and that is patients and doctors. Where this is headed right now, are we creating a situation that not only creates more choice and more treatment for patients, but one that also allows doctors to feel that they are less under the burden of either some sort of government restriction, insurance company restrictions, or legal restrictions? In other words, what are we doing to empower doctors to be better doctors in inflation?
Well, hopefully we've let them out from under a little bit from the pressure of the insurance industry, but make no mistake about it, and you know, this is one of your signature issues, as it should be. The fact of the matter is, all this talk about the public option is just a sliver of a small population, those that are uninsured. Doctors, unfortunately, are still going to have to wrestle with insurance company bureaucracies and 800 numbers. They're still not going to have the efficiency that programs like Medicare have with only 1% overhead. You know, I feel that we should have a single-payer thing like Medicare for all Americans, but you're right. Doctors are still going to wake up tomorrow morning or after this bill is passed and realize the headache that is the insurance industry is still going to be on their back.
Are you concerned about the political backlash of selling health care reform to America when they find out that a lot of people don't have choice, that people will say, oh, there's a public option victory, except for nobody that's at the victory party can use the public option? The doctors have the problems that you just described. Are politicians in Washington setting themselves up for a rude awakening if they try to sell a health care reform package that doesn't actually solve the on-the-ground issues of patients and doctors?
100%. I think that one of our great challenges as a group here in Washington is, after all of this drum and all of this activity, that we have to show that it actually accomplished something. You know, when my colleagues fought so hard to water down or eliminate the public option, all they were doing is saying, let's leave the status quo more intact. The American people are paying too much for the status quo. They expect it to change. Our challenge is going to be to show that this bill actually makes their lives better, and I fear that if we weaken it much more, we're not going to be able to demonstrate that.
Yeah, and again, I know that you have been aggressive in pushing for more meaningful reform. I have to wrap this up. The threshold of bigger change is greater fear and anxiety. The liability of no change is an endless, disastrous money pit with a lot of people uninsured. How do you overcome the fear of change to get what we need done to avoid the disaster that's a certainty if we do nothing?
Well, we have to explain to the American people there was the same anxiety when we created Social Security, the same anxiety when we created Medicare, two programs that work exactly as they were intended, and we know what the status quo will get us. Your insurance policy will cost $1,000 more next year. Another 17,000 people today are going to lose their insurance. The health insurance lobby wants it to stay the same because they gain while the rest of us lose.
Representative, we appreciate your efforts on our behalf. Thank you very much, Anthony Weiner.